sleep, a time when the body relaxes, recharges, and heals. But not all of us are sleeping well. According to the National Commission on Sleep Disorders, 1 in 6 Americans suffer from some degree of sleep apnea, a common, potentially serious medical condition in which breathing repeatedly stops and starts.
Obstructive sleep apnea is when you stop breathing for more than 10 seconds at a time during your sleep, and that is also associated with a drop in your oxygen levels or a desaturation over 4%. And many millions of Americans suffer from this. If it's not treated, obstructive sleep apnea actually will increase the risk of heart disease, stroke, diabetes, depression, anxiety, many chronic illnesses that can end up life-threatening. And by not treating severe obstructive sleep apnea, you could be reducing your lifespan by over 7 to 10 years.
Sleep medicine experts say up until now, many believed that sleeping on a breathing or CPAP machine and expensive major surgery to enlarge the airway were the only ways to cure obstructive sleep apnea. Dr. Singh and his colleagues are working to ensure that more and more people living with obstructive sleep apnea can soon have a potential cure that does not involve the CPAP machine, drugs, injections, or surgery. By specifically educating and training dentists across America on the proper way to apply the DNA Appliance System, an FDA-approved biomimetic oral device designed to gently increase the size of the jaw and increase the volume of the upper airway.
The main difference between the DNA Appliance System and the other oral devices is the concepts on which it's built. We want to harness the potential of the body to heal itself from the inside out, and we can do that by tapping into the genetic potential of each individual. What this means is that instead of wearing a device for the rest of your life, there's an opportunity, a chance for the device to actually work in harmony with the body so that the condition is resolved, potentially cured, in a period of about 18 to 24 months, and that gets people into a very strong position for health and longevity. Essentially, we're growing the airway from the inside out. The way you can do that is by using a patient's genetic potential. Those are the genes that you were born with, the genes that you keep for life, the genes that you inherited. The results have been quite remarkable. Mild cases, moderate cases which have been resolved. And what we mean by that is that the apnea-hypopnea index, which is a scale used to say, do you have sleep apnea, and if so, how severe is it? Those numbers come to less than 5, which means that these patients no longer have sleep apnea. The great thing is that there's nothing in the mouth when this patient is sleeping. So what you've done is being able to restore natural sleep for this patient in a short period of time by using these devices. Let's take an older person who is starting to get some chronic conditions. We can improve that patient with no drugs, no surgery. There's no injections involved. It's a pain-free procedure. Now let's think about a child who has breathing or sleeping issues. If we are able to correct that child's breathing and sleeping, this child's going to do better in school. They do better in school, they get better grades. The chances are they'll get a better job, they're going to have a nice and more promising lifespan ahead of them. It's literally a life-saving procedure from that aspect. One of the most promising things about the DNA Appliance is that it's fully covered by medical insurance. Our overall mission is to improve the lifespan and the health of a broad range of people.
The results that I've seen from treating obstructive sleep apnea over the last 5 years with the DNA Appliance have been outstanding. I've had patients with mild to moderate sleep apnea be resolved in as short as 6 to 12 months, and I've had patients with severe sleep apnea be resolved in 12 to 18 months of treatment. I've treated hundreds of patients, and the most rewarding thing that I can say is when a patient comes back to my office and says, "Thank you for giving me my life back," and they have no more obstructive sleep apnea. That to me means a lot.
Learn more today about the DNA Appliance System, a simple, painless way to put obstructive sleep apnea to bed. Ask your doctor about the DNA Appliance System.